All right, everybody, this is Flexibility from the Physical Best, Chapter 7. The definition of flexibility is that flexibility is the health-related component of fitness that characterizes the range of motion of a single joint or series of joints. A few benefits of flexibility. Being flexible prevents low back pain and prevents injury in general. It helps relieve muscle cramps. It facilitates relaxation and stress relief for both physical and mental stress. And it improves our joint range of motion and our body coordination, especially if we are participating in activities such as yoga. A few different factors that affect flexibility. The first is tissue interference or joint type. So as you can see on the screen, I have two different types of joints. The first joint, we're looking at the elbow there. So the elbow is a hinge joint. And the range of motion is going to be much less compared to, I have a picture of the shoulder joint there, compared to a ball and socket joint. Because for the hinge joint, when I extend my elbow all the way, there's going to be bone inhibiting further movement. However, compared to the ball and socket joint, so our shoulder joint and our hip joints are ball and socket joints, and we can move those joints in any direction. We don't have any inhibition whatsoever. And then moving on to muscle temperature. So when our muscles are warmer, we are going to be able to exhibit greater flexibility compared to if our muscles are at a cooler temperature. Maybe we haven't warmed up properly, or maybe we're just, sitting in a really cold environment. Moving on to age and gender. So individuals that are younger are typically more flexible compared to their older counterparts. By the time we all reach, our 80s or 90s, we are going to be diagnosed with something called osteoarthritis. And osteoarthritis is the breakdown of our joints, and that is just something that naturally happens to all of us. So these joints are going to start to break down a little bit, and that is definitely going to affect our flexibility. And then gender, so females typically tend to be more flexible than males. Moving on to genetics, so a small piece of our flexibility is inherited, especially if you've ever heard someone that has stated, oh, I am double jointed. But you know what? In reality, that statement, of being double jointed, it is impossible for us to have an extra joint. So when individuals say that they are double jointed, they actually have a joint that is a little bit longer compared to the average population. So that is what leads to that hypermobility or that, that hyperflexibility. And then finally, the FIT principle: frequency, intensity, time, and type. The more you stretch on a regular basis, the more flexible you're going to become. So moving on to different types of stretching. So we have static stretching, and we have two different types of static: active and passive stretching. Then we have ballistic, dynamic, proprioceptive neuromuscular facilitation, also known as PNF stretching, and then yoga. And we'll talk about all of these in detail. So our first type of stretching is static stretching. So this type of stretching is very, very common. During this type of stretch, we are going to slowly move into our desired position, and we're going to feel, slight tension or even a little bit of discomfort during that stretch. But once we reach that position, we are going to stay and hold that stretch for at least 10 to 30 seconds, or maybe even a little bit longer if you prefer. And this technique is mostly recommended for kids. It's safe and it's really easy to perform. So we have two different types of static stretching under that main umbrella So we have active stretching, also known as unassisted stretching, and that is where we are using our body, ourselves, to produce that stretch. We're not getting any help from an outside or external source. If we were to get help from an external source, some sort of external force, we're using, maybe a partner is guiding us through that stretch. We are stretching ourselves up against, a wall, or maybe even using a belt or a strap to guide us through that stretch. That is passive stretching. So we are using an external object or a person in order to help us through that stretch. But like regular static stretching, we are still holding that stretch, holding that position. Moving on to ballistic stretching. So ballistic stretching is this jerky, bouncy type of stretching where we're using momentum to produce a stretch. This type of stretching is not recommended. You see that little asterisk there. So it's not recommended for the average population. However, if you are an athlete, a dancer, or a gymnast that uses ballistic stretching on a regular basis, and if you've been doing it for years and years, then it's safe for you to continue. But if you've never done this type of stretching before, there's no need to start doing it now. This can actually be quite dangerous because when you're moving through those bouncy, jerky movements, while the muscle is stretching, it could also try to relax at the same time, which could cause a little bit of damage and even potential injury. So this is what ballistic stretching looks like. Most commonly we'll see people that'll try to touch their toes, and then they're bouncing up and down rapidly to get down to the floor to touch their toes. And then here are just a couple more examples of ballistic stretches. But again, we're using that momentum to bounce up and down, forward, moving those arms forward in order to achieve that stretch. Moving on to dynamic stretching. So dynamic stretching mimics functional movements. We are moving, well, not very slowly, but we're moving through a controlled fashion. There are no jerky movements like that are used in ballistic stretching, and this is most appropriate for a warm-up before before that class session, before that workout, before the main conditioning phase. We want to make sure that we are programming a dynamic warm-up before we get these kids moving. So again, like I mentioned previously, dynamic stretches, dynamic movements mimic functional movements. So it's things like, Frankenstein's or windmills or high knees, or even an air squat, maybe doing some arm circles if we're going to be doing, swimming that day, for example. But dynamic movements are going to mimic the things that we're going to be doing during our workout. These are excellent, and they're recommended for kids, for all ages, actually. Moving on to PNF stretching. Remember, that's proprioceptive neuromuscular facilitation. So this type of stretching, this is mainly used in clinical environments. So usually at a physical therapy clinic, occupational therapy, rehabilitation setting. This type of stretching does yield the greatest improvements in flexibility. However, you do need to learn how to perform it properly, because it is very easy to get hurt performing this type of stretching. You usually perform this stretch with a certified professional, so usually with a physical therapist, an occupational therapist. The most common type of PNF stretching is contract, relax, contract stretching. So for example, we have our trained facilitator here. He is going to apply some pressure on the top of her shins here, and she is going to contract and push against him. Then he's going to relax, take off the pressure. She's going to relax those muscles, and then she's going to contract again once he applies pressure to her shins. They keep going back and forth through this contract, relax, contract pattern, and eventually at the end of the session, her knees should be closer to her chest there. So this is a type of stretching that is not suited for young kids. This is technically something that you could do for high school students, but if you don't feel comfortable teaching it, if you haven't learned it yourself, just stick to good old static stretching. And then finally, the last type of stretching we have is yoga, and there are many different types of yoga. The most common type of yoga in the Western world is Hatha yoga. But again, many different types of yoga. In yoga, we use many different body positions called asanas. So you can see have a few pictures, cartoons of different asanas here. And sometimes during yoga, there are specific breathing techniques that you need to adhere to. Yoga is excellent for stress relief, both physically and mentally. It's excellent for body coordination. It's great to, whether you want to start the school day with it or end it with 5 minutes of yoga. There are a lot of resources for classroom or desk yoga, and I'll be posting a few resources on Canvas for all of you, and just in case you're interested. Okay, so when it comes to teaching flexibility, always make sure that you're giving clear instructions, emphasizing proper form always. It's important to infuse dynamic movements, dynamic stretches during the warm-up, and also infuse static stretching during the cool downs. If you wanted to add flexibility to a sort of circuit training routine for the day, you could have a flexibility station, but I recommend that you have that towards the end of that routine. And then always make sure that you are talking about goal setting, that students have their own individual goals for the day, as well as individual specific goals as far as flexibility goes. Making sure that we're establishing a regular schedule of flexibility fitness lessons. I highly recommend that you all always include a dynamic warm-up at the beginning of the session and a static cool down at the very end of class. That way when students, get to the PE session or get to your physical education class, that they know that that's what the layout of the day is always going to look like. Dynamic warm-up at the beginning, the conditioning phase of the workout, and then a cool down, that static session. Some safety considerations, making sure that we are using slow and controlled movements. We don't want to recommend that bouncy ballistic stretching. We don't ever want to force a stretch. Stretching should not be painful. We should feel some slight discomfort, slight tension in that specific muscle that we're stretching, but again, it shouldn't hurt. Make sure that you encourage all of your students to breathe normally when stretching. A lot of individuals tend to hold their breath when they stretch, and we don't want anybody to pass out, so encourage regular breathing. And then we want to make sure that we are protecting our neck and our spine in general, so making sure that we are avoiding any hyperextension, any overarching of the back of the neck. And like I mentioned previously, this is really important, talking about the warm-up and the cool down. So for the warm-up, we're using those dynamic movements. This is really the most effective for preparing the body for physical activity, for movement, for that exercise portion of the day. Once they've completed that, they'll complete the conditioning portion of the workout and then move on to their static stretching for the cool down. And I recommend that you do the warm up and the cool down all together as a big group. Just round everybody up and get in a big circle if you want to be in the middle or on one of the edges of the circle so you can see everyone. That works perfectly. And just make this into a routine so the kids know every single time, they're gonna, get, whether you put them in small groups for their dynamic warm-up or one big large group, that's what they're gonna do first, that dynamic warm-up, and then at the end of class, that static cool down. So when we apply those basic training principles to flexibility, first starting off with overload, so we need to apply a little bit more stress in order to cause a change in our flexibility. So we need to stretch that specific muscle group until we feel that slight tension, that slight discomfort. But again, we shouldn't feel pain. If we feel pain, we need to ease back on that stretch. But just as long as we feel that slight tension, we should be fine. Moving on to progression, one way that we could progress with flexibility is by increasing the amount of time that stretch is held. So ideally, we want to hold each stretch anywhere from 10 to 30 seconds. But once we've reached 30 seconds, if we can go a little bit longer than that, that works as well. 45 seconds, a minute. And then moving on to specificity, so if we want to increase our flexibility in a specific body part or a body area, we need to make sure that we are stretching those specific muscles. So if you have students that come to you and they want to be able to touch their toes, making sure that we perform plenty of stretches for their hamstrings, for their quadriceps, and for their low back. Moving on to regularity, so making sure that we're stretching anywhere a minimum of 2 to 3 times a week, but we can actually stretch every day if we wanted to, every day for, 10 to 15 minutes would be perfect. And then finally, individuality, making sure that that student is setting specific goals based on their individual needs, as well as their own physical limitations and their own personal motivation. Some students might want to increase their flexibility, for a specific purpose. Others might be involved in other sports where they require a greater need for flexibility. So, but that all kind of wraps around their own individual needs. Moving on to the FIT guidelines for flexibility. So the frequency that we should be stretching, again, a minimum of 2 days per week, but preferably every single day, at least 10 minutes, full body stretches. Or you can even split that up. You can do, lower body stretches on a couple of days, and then move that to upper body stretches on other days. But that's totally up to you. And then intensity, so we want to move slowly into the stretch until we feel that slight discomfort. The time, we want to hold those stretches anywhere from 10 to 30 seconds. And then the type, ideally, we're going to be using static stretching to increase our flexibility. Okay, so let's talk about flexibility assessment. So when we assess our flexibility, there is no general test for full body flexibility. We need to test specific areas of the body. So we have the back saver sit and reach. That's this over here in this lower right-hand corner. And this test is going to measure low back and hamstring flexibility. And then we have trunk extension. We can see this young lady is doing here, where we're having her lie on her stomach, and we're going to have her, lift her trunk, her upper body off of the ground, while her chin is level with the floor. And again, we're measuring that upper back, upper trunk flexibility. And then we have the shoulder stretch over here. measuring shoulder flexibility. If the fingertips touch, so you can see that his fingertips are barely touching right there, that is considered to be a pass. So this student would pass for his right side. We would have him repeat, switch arms for the other side to see if he has the same excellent flexibility for his left side. All right, and that was flexibility.